Good afternoon. My name is Inez Ponce, and I am the director here at the UCLA Center for Health Policy Research. Thanks for joining us today. As a land-grant institution, we acknowledge the Gabrielino Tongva peoples as traditional land caretakers of Tovangar, the Los Angeles Basin and South Channel Islands. Today's online seminar is the California Elder Index 2019 release, Basic Economic Needs of Older Adults and Profile of Those Struggling to Make Ends Meet. In California, the population of older adults over 65 is expected to nearly triple in the next 4 decades, from 5.5 million in 2016 to 13.5 million in 2060, according to the California Department of Finance. As the fastest growing age group population in the state, there are many health policy, economic, and social implications to consider to ensure that this population achieves and sustains an optimal quality of life. This assures that the golden years are indeed golden. By linking access to safety net programs with federal poverty guidelines, this potentially, though, that hundreds of thousands of older Californians are economically insecure. This economic insecurity may translate to poor or worse health outcomes and well-being for this population. So today, my esteemed colleagues, Imelda Padilla-Frausto, research scientist, and Steve Wallace, our Associate Center Director, will launch the 2019 California Elder Economic Security Standard Index, also known as the California Elder Index. The California Elder Index uses publicly available data, including our center's California Health Interview Survey, on the actual cost of basic living expenses for housing, healthcare, food, and transportation. These data are used to guide legislators and organizations to create effective policies and programs to assist the ever-growing aging population, as well as to address and eliminate disparities for various groups within the population. My colleagues will go over factors related to disparities in race and ethnicity, as well as the impact of the COVID-19 pandemic. This webinar is co-sponsored by the Maida Fund, a private foundation dedicated to advancing the health and wellness of the San Francisco's city's older adult population. Next slide, please. If you're interested in today's slides, you can request them from our communications department at the email address shown in your screen. And please stay tuned for announcements on the October 29th seminar on the highly anticipated official release of the 2019 California Health Interview Survey. Our data will highlight findings on a wide range of health topics, such as access to healthcare, health conditions, mental health, voter engagement, public charge, and much, much more. I'd also like to urge all of you to attend our upcoming 2020 E.R. Brown Virtual Symposium, Healing a Fractured Society, Healthcare as a Right. This will occur on Wednesday, October 14th. Health policy leaders, community advocates, policymakers, researchers, and more will come together to discuss the way forward to mending our fragmented healthcare system and addressing health equity. So please visit our website or contact our team to register. Now, I'd like to kick off the seminar with my colleague, Steve Wallace.
Thank you, Inez, and welcome to everybody for our center seminar. We can go ahead and next slide. So we want to acknowledge the funders who have supported the development and continued updating of the Elder Index over the many years that we've been doing this. As Dr. Ponce mentioned, the Maida Fund has been very generous in supporting us recently. But as you can see here, we have a long history of support from a broad range of foundations and university sponsors over the years. So this is definitely a village helping support this project. So then I'll give you a brief outline of what we're going to talk about today. We're going to talk first about how we measure economic insecurity. Dr. Ponce mentioned the federal poverty guidelines, which are what a lot of public programs are benchmarked to, and the problems with those guidelines, and then how the Elder Economic Security Standard Index for California addresses the limitations of the federal poverty guidelines. I'll then hand it over to Dr. Padilla-Frausto, who will give you the data, the actual updates to what we've been doing, and show you in more detail than we have in the past, actually, who is economically insecure among California's older adults. She'll then hand it back to me, and we'll briefly discuss some of the implications of the data that she's presented in the COVID era, which we are all definitely still in the middle of, and end on a hopeful note of how we might be able to increase economic security for older adults in the state. So with no further ado, we'll get into the background of the federal poverty line. So the federal poverty guideline for the United States currently is $12,760, and that is one number established everywhere. So the federal poverty guideline was developed in the early 1960s. They used the data they had available, and at the time it worked as well as could be expected. It has been updated for inflation, but the basic methodology is the same as was used 50 years ago. So you have one number for the entire country. And what this map shows you, you don't need to get involved in the details, but shows you the fair market rent as determined by the US Department of Housing and Urban Development for one bedroom apartment. And the darker the color, the more expensive it is. So if we were live, I would ask somebody to raise their hand and tell me, what's problem number one with using the federal poverty line? And I would point to you, and you would say, cost of living varies dramatically, driven by housing costs across the country, but it's just one number. So that's problem number one. And the next slide shows the actual dollar amounts, just to give you a better sense of how much it varies. So in San Francisco this year, the fair market rent for a one bedroom apartment is $2,720. I often show this to people in the locations where we're giving the numbers, and in San Francisco, they always look at these numbers and go, oh, can you show me a decent one bedroom apartment for that? So it may sound outrageous, but that is actually what you are facing if you're trying to find an apartment in San Francisco today. Interestingly, Los Angeles is not far behind. Orange County, not far behind that. And LA, San Francisco, and Orange County are all more now than the New York area is for one bedroom apartment. So you can see the coastal differences, and then you go all the way down to Brownsville, Texas, and that same one bedroom apartment can be had for just under $600. That just gives you a sense of the differences in cost of living across the country and why a single federal poverty guideline is inadequate to show you that. Not only that, but it is insensitive to housing ownership or the type of housing people are in. So I've been showing you fair market rents. The proportion of people on the next slide shows you whether people are renting or owning, and if they own, if they have a mortgage or not. So in the far left-hand corner, you can see among people below the federal poverty line in the United States, 40.2% of older adults own their homes and have their mortgage paid off. So that's the image of older adults in most policy circles. Most policymakers feel that older adults own their homes, they have no mortgages, and so their level of need is relatively low. That isn't the normative case nationally. Another 19.2% own their homes and are still paying a mortgage. And nationally, 40.6% of those under the federal poverty line are renting. So those are the ones that are facing the costs I just showed you across the country. In Los Angeles, it's actually much higher, 60% rent. California-wide, it's a little bit lower than that, but still much higher than the US. And as you can see in LA and in California, like I say, the trends are roughly similar. Only 20%, 1/5 of the poorest older adults have their homes paid off. So most older adults are actually facing current costs. They're not facing costs without rent or mortgage. If you look at the 100 to 200% federal poverty line, and Dr. Budia-Frausto will show you that you need to include that group if you're looking at economically insecure in California. Similarly, half are renting, and another quarter are still paying on their mortgage. So it's really not until you get into the middle class group that you are able to see a substantial number of people in California who own their homes. So problem number 2 with the federal poverty line is it's the same amount whether or not people own or rent. And the costs, especially for renters, is in most cases changing from year to year. So problem number 3 in the next slide is that older adults have different patterns of expenditures. So most notable is that older adults are more likely to spend more of their income on healthcare. The 75-year and older, it's almost 12% of their income goes for healthcare. And once again, policymakers don't think about this because they say, but older adults have Medicare. Doesn't that pay for everything? And the answer is no, it doesn't. And so healthcare is a major cost driver for older adults. And you can see that in housing, this is all older adults nationally, but they spend about as much on housing as younger adults do. So once again, that inaccurate belief that older adults are insulated from housing costs because they own their homes is false. The other part of this is when the federal poverty line was established, it assumed, or they used data from the 1950s actually, that said that about 1/3 of household costs went to food. And so you can see now that food is a much smaller proportion of the household budget, but the way they calculated the amount of need was based on that. So it's another reason why the federal poverty line underestimates actual need. And so now I'll turn it over to Dr. Budia-Frausto, who will actually show you what this turns into in real dollars and cents and people.
Thank you, Dr. Wallace, and thank you, Dr. Ponce, for that introduction. So the Elder and Economic Security Standard Index takes the actual cost of basic necessities for older adults, and it really reflects their actual cost of living. It is adjusted by county versus, as Dr. Wallace mentioned, the federal poverty level, which is a national amount. We do calculate it for renters versus owners, both those who own a mortgage and those who have paid off their mortgage. And this, the Elder Index definitely reflects the healthcare needs of older adults. We use publicly available data. For housing, we use the American Community Survey, their 5-year files, to calculate homeowner costs, both for those who own their house outright and those who are still paying on their mortgage. For renters, we use the U.S. Department of Housing and Urban Development. We use a 3-year average to adjust for any sort of major increases or decreases in rent cost. We use the current year premium cost for Medicare Part B and the premium for Medicare Advantage, where 20% or more of the county is in any Medicare Advantage plan. For counties falling below 20%, we use AARP plan plus a Part D prescription. For food, we use a 3-year average of the low-cost food plan from the U.S. Department of Agriculture. For transportation, we use California data for annual miles driven from the National Household Travel Survey. And then for miscellaneous, we calculate a 20% of total cost. To give you an idea of what those costs look like, here we have the statewide average cost for each of the components by housing type for single elders living alone. We see the cost for different housing types can make a significant difference in an older adult's budget, where those who own a home but are still paying a mortgage can have the highest housing costs at almost $2,000. Renters have an average cost of around $1,000, and homeowners without a mortgage around 550. Even though we see here on the California average that the other cost components, it seems like they don't change for the California average, but by county, these costs actually do change and vary by county. Some of the big differences we see are in housing and healthcare between urban and rural counties, not only in overall cost, but also in the percentage of income that goes towards each of the components. For a single elder renter in San Francisco County, their monthly expenses are almost twice the amount of a single elder renter in Imperial County, $4,000 versus $2,000 a year. Housing for the single elder in San Francisco County is 70% of their budget, more than 2 times the percentage for a single elder in Imperial County. However, for the single elder in Imperial County, almost 30% of their budget will need to go towards healthcare expenses. This is nearly 4 times the percentage for a single elder in San Francisco County. And this has to do a lot with the availability of HMOs and Medicare plans in rural counties. When we compare the actual cost of living for a single elder who rents with an average income and the FPL amounts for a single person, we see an extensive gap in the income needed to meet their basic needs. On average, single elders who rent need more than 2 times the maximum SSI SSP amount, and more than 2 times the median Social Security, and more than 2 times what the federal poverty level considers sufficient income. The gap between basic cost of living for a single elder renter and income sources in the FPL has been increasing over the past 7 years. Here on the top line, we see the elder index steadily increasing and increasing the gap between the FPL, shown here with the X, is pretty stable across time. It doesn't increase very much. Here, the median Social Security with the diamonds increases a little bit, but pretty much stays stable. And then we have the SSI, SSP amounts with the circle here, also pretty stable. When we look at the county comparisons of the basic cost of living for single elders who rent, we see a high cost in San Mateo County at around $46,000. And the lowest we see is in Kern County with about $21,000. And in between, we selected counties, San Francisco, which is almost close to San Mateo, and then Los Angeles City. All of these are above the federal poverty level here in the dark red line. The California average for the elder index for a single elder who rents is here in the lighter red line. And we see that these 2 counties go over that. LA City is just almost there, and Kern County is a little bit below, but definitely above the FPL line. So what does this look like in terms of the number of older adults who fall with incomes below the elder index? For this, we have single elders in all housing types, and we look at the number who are poor, which is considered by the federal poverty level, and those who are among the hidden poor, which are those with incomes above the federal poverty level but below the elder index. And these are the folks that often get missed because they have incomes above the federal poverty level. Many people think they are not struggling. However, as we see, they are. And so among renters, single elders who rent, there's about 500,000. We see about similar amounts who are poor as hidden poor. For those with a mortgage, we see less who are among the poor, but definitely more among the hidden poor. And for those without a mortgage, we see almost the equivalent amounts of poor versus hidden poor. What this looks like by gender is we see that females have higher rates of economic security versus male. However, both tend to have equal amounts of insecurity among the hidden poor, and women tend to have a higher percentage among the poor. When we look at the different age groups, so younger older adults versus older adults, we see about the same proportion of those who are among the poor, and we see a slightly more proportion of those who are older adults being among the hidden poor. By race and ethnicity, we see that Latinos are more likely to be economically insecure versus non-Latino whites. Asians, American Indians, and Blacks all have significant economic insecurity, where Asians tend to have a higher percentage among the poor and a lower percentage among the hidden poor. Among American Indians, slightly higher percentage among the hidden poor than the poor, and for Blacks, non-Latino Blacks, there is slightly a significant more proportion in the hidden poor than the poor. However, when we look at Latino groups by sub-ethnicity, what we see is that Central Americans actually have the highest economic insecurity among Latinos, with 51.9% being among the poor and 31.6% being among the hidden poor. Here we have Cubans, about 40% among the poor and 35% among the hidden poor. South Americans, 32, about equally the amounts, same amount among the poor and the hidden poor. Almost the same amount for Puerto Ricans, and a slightly less percentage among Spaniards in the poor versus hidden poor. When we look at this by Asian ethnic populations, we see significant differences here. For Vietnamese, who are about 80% who are economically insecure, and 70% of them are among the poor, and 18.8% are among the hidden poor. And as we go down, we see the rates of the poor slightly decreasing as the hidden poor slightly increases. Here among the Native Hawaiian Pacific Islander population, older adult population, we see the percentage of hidden poor versus poor almost to be the same, but slightly higher among the poor. For Chinese, they also have a higher percentage among poor than the hidden poor. And with Filipino, we have almost the same percentages here among the poor and the hidden poor, and for South Asians, almost the same amounts here. And for Japanese, they have the least economically insecure, but they do have a higher percentage of hidden poor versus poor. When we look at this by citizenship status, what we see is a significant difference between those who aren't US citizens versus those who are US born US citizens. And then we have the naturalized citizens in between those two. We have a higher percentage of those who are poor among those who are foreign born, and we have about a quarter who are among the hidden poor in both of those. When we look at the percentage of poor versus hidden poor by select counties, we actually found the highest percentage of economically insecure to be among older adults residing in Imperial County, and the lowest economic insecurity to be older adults in Napa County. However, there's still a significant proportion who are among the hidden poor and Napa County. And here in between, we have San Francisco County and Los Angeles City as a comparison. In between those two extremes, in San Francisco County, older adults are a little bit more likely to be among the hidden poor than the poor. And among older adults in Los Angeles City, a little higher percentage to be among the poor than the hidden poor. And now I turn it back over to Steve for implications of these findings.
Great, thank you. So I'm not supposed to be watching the chat, but somebody actually asked about the data in terms of income was all pre-COVID. So what we're generally looking at is older adults who are primarily retired. And so retirement income should not vary dramatically as a result of COVID. However, the US Census has done a short-term web survey of a large number of people across the country. And they did find that older adults, age 65 and over, in California, whether or not they were working, they asked about whether or not the family that they were living with had experienced a decrease in income since COVID started. And about a third of those families did say yes, that they had, now they did collect detailed income information, but they were reporting changes in income. So it's important, and Dr. Padilla-Frausto showed older adults living alone, so this would not be the case. But there are many older adults in California who are living with family members who may be in the labor force. Excuse me. Some of them are younger adults who have moved into the homes of their parents. And that's a potential bullet here. So if a person is laid off from their job, they're unable to pay their rent. We saw in the last recession, in the recession of 2008, a big spike of adults moving into older adults' households. So that's typically a younger adult who has lost a job or is facing some of their own economic insecurity, doubling up, and then you've got an extra mouth to feed and extra expenses due to that person. So we don't yet have data on co-residence patterns, but we would expect to see, as a result of COVID-19, an increase in the number of adult children who are doubling up with their parents, which would then increase the need for income in those groups. In addition to that, some of the supplies that older adults are going to need are going to be increased. Older adults, as everybody knows, are at the highest risk of death if they contract COVID. And so a larger proportion of them, definitely than college students, but then the population as a whole, are sheltering in place, doing things like asking to have food delivered if they can afford it, and other types of accommodations for not interacting in a general space. And so their costs may be going up as a result of that. Finally, there's a lot of income sharing that occurs among generations, even if people don't live together. So until age 75 nationally, most of the income transfer between generations is from older generations to younger generations. So that means that the younger elderly, almost independent of their income, are more likely to be giving money to children and grandchildren to help them make ends meet, or to pay for major expenses, buying a car, fixing a roof, than the other way around. So once again, given the economic disruptions of the last several months, we would expect that the income sharing among generations is increasing. And then just the general psychological distress. I know everybody on this team has felt it over the last 6 months. And I'll show you some data from that national tracking poll about psychological distress and income. And then finally, there's hasn't been a lot written on older adults and the economic impacts on them of COVID, but there is some literature that's starting to come out that's worried about what's going to happen to people who are near retirement who have lost their jobs. So I think most people know that if you lose a job at age 55 or later, the chances of getting a job again drop dramatically, especially if you're in a blue collar position or a service job. And so there will be a lot of near elderly adults who will enter old age with lower pensions, with fewer savings if they had any to start with, and other types of challenges to economic security that we'll actually see for the next several generations because of that. So let me show you just a little bit of data that references some of this. So California Health Interview Survey asked people if they had problems paying medical bills in the last year. So once again, this is pre-COVID. So in 2017-18, older adults in California, if you had a family income below the federal poverty line, 7.4% reported that in the past year, they had trouble paying medical bills. If you were in that near poor category, which is maps very roughly to the hidden poor, 10% said they had trouble paying medical bills, compared to only 3.7% for higher income adults. So you can imagine if you're in a household, you have an adult child with you now that you're helping feed, you're helping your grandchildren who've been laid off or furloughed. These numbers were during a relatively healthy economic period, so you can imagine that they would be going up. So implications for health and health outcomes would be worrisome. And then the next slide shows you actual data from June of this year. So this is the Pulse survey that the census is carrying out. It's a 1 week long survey, several 100,000 respondents. And so for California respondents age 65 and over, the bar on the left is under $25,000 family income. That's the only income variable they have. So for a single older adult, that's not bad for elder economic insecurity. For a family of four, it's way below. But in any case, so lower income families are much more likely to have older adults who express levels of anxiety. 3/4 had any anxiety symptoms in the past week. If you go to the highest level of anxiety, where they're reporting anxiety symptoms every day, the gap is similar. Naturally, the number is much lower, but you still get these income gaps. So anxiety, worry, and depression, as you can see, are all pretty level across low income. They vary a little bit for the not low income group, but we can assume that the mental health needs for older adults, particularly those with incomes below the elder index, are going to be heightened at this time. And accessibility to healthcare services, whether it's because of economics or because older adults are hesitant to travel outside their homes to go out to get psychological services, suggests that this is going to be an issue going forward as well. All right, so what can we do about all of this? So the next couple slides give us some thoughts about how do we improve health equity and economic security in the future. Putting COVID-19 aside, there's immediate needs that we have, and in the long term, there's basically two ways to improve economic security for older adults. One is you increase the money coming in, so you increase their income. We're going backwards in COVID, so my first bullet is raise income during working years. The more money you make as a working adult, the better you will be positioned, whether it's your Social Security benefits, the potential to save money, or if you're fortunate enough to have a pension at work, it'll be higher. As I mentioned, right now, it looks like we're going backwards. And so family income, at least, and definitely income for those who are nearing retirement is likely to be down for the next several years. So that suggests a worsening of economic insecurity. Pension coverage can improve. In a longer talk, we could go over the proportion of people with pensions versus contributed pensions like a 401k, but even a lot of businesses don't offer 401k types of plans. And California has a new program for those individuals, but try to provide more income for people in their older years. And we can provide caregiving credits through Social Security. So a lot of women take time off from paid employment to care for their parents and grandparents, and that affects their Social Security when they retire. A number of countries offer credits for family members who are caregiving and are not in the labor force because of that. As I mentioned, that's disproportionately women, although not exclusively. We can talk about increasing the lowest Social Security and Supplemental Security SSI payments. So bring up the floor. And then the very last one is a highly technical issue that gets raised every couple years. But basically, change CPI is a way to lower the indexing of inflation for Social Security and other benefits. And so this is a battle that has been joined. The issue, I believe, came up again last year in Congress. But when you hear the word change CPI, just assume that it's policymakers who want to reduce benefits for people that receive them over time. The other way of doing improving economic security on the next slide is to decrease costs. So you can keep income stable, and if you decrease costs, you're going to improve economic security. Housing costs are really the driver in economic security in most areas. In some areas, it's healthcare. But if you asked me if I had one policy I would change or one wand I could wave, it would be decrease housing costs for low-income seniors. That includes increasing affordability for renting or buying. There's a number of attempts, including in Santa Monica, to help those in rent-controlled apartments who are severely rent-burdened to stay in those rent-controlled apartments. So there's housing subsidies, there's shallow subsidies, there's deep subsidies. There's a whole variety of ways to decrease housing costs. And one of the challenges in the housing field is lack of funding. So there have been proposals to link housing assistance to some healthcare programs, because housing is healthcare as well. And then finally, we can suggest in the next slide, if you improve health earlier in life, we know through the life course, a healthy earlier life leads to a healthier later life. That would decrease healthcare costs. Can reduce out-of-pocket medical care costs, whether it's increasing Medicaid eligibility by increasing the various disregards or the eligibility levels. And in our work, we assumed that if Medicare managed care had a high penetration in a county, that was available to everybody. And that makes actually a very substantial difference in out-of-pocket costs for older adults who don't qualify for Medicaid, Medi-Cal in California. And so offering that type of protection to people's incomes would be important. So there's a number of things we can do, we have in our power to do to increase incomes now, increase incomes of the next generation of seniors, to decrease the costs that they're facing. And we know that there's a lot of Californians who are economically insecure in old age because of that mismatch between their incomes and the expenses that they face. And so on the next slide, we will say thank you. And then we'll open it up for questions. And I believe Tiffany's gonna moderate our questions.
Thank you, Dr. Wallace. Good afternoon. My name is Tiffany Lopes, and I'm the Director of Communications here at the UCLA Center for Health Policy Research. We're going to be going through questions from the audience today. So if you haven't already, I encourage you to use the Q&A function in Zoom to ask questions. And thank you both for the informative presentation. There's a lot of data here and a lot of questions from the audience. So let's get started. Can you please expand on how to interpret the small differences in the index by population subgroup? And do small but significant differences reflect meaningful levels of insecurity, and what level is meaningful?
Steve, do you want to take that one?
So can you say that one more time? Sorry, I was fighting with controls on my computer when you read that.
Sure thing. Can you expand on how to interpret the small differences in the index by population subgroup? And do small but significant differences reflect meaningful levels of insecurity, and what level is meaningful? So
the data that we were showing gave you the numbers of people, or the proportion of people who were economically insecure. And what was helpful was looking at the pattern of those who were under the federal poverty line versus under the California Elder Index. really is a demonstration that the federal poverty line really doesn't capture a large number of people who cannot afford to make ends meet, and that by including the Elder Index as part of planning or budgeting or other types of policies, that you really get a better sense of the need in the state. So if one population had 49% economically insecure and another had 47% economically insecure, the importance of that narrow difference is I would say more of a trend. I would not prioritize the 49 over the 47. They're both close to half economically insecure. So I think what you're better thinking about is what are the trends and the patterns than a specific comparison of two groups, unless like in the data it showed, so non-Hispanic whites, 25 or 30% are economically insecure, which is still way above what the federal poverty line says and what you normally think about. When you compare that to the 80% who are economically insecure in one of the groups, then that clearly is an area where you need to prioritize.
Thank you. Any thoughts about what we can do to support older workers who don't qualify for Social Security yet, but are unable to find work after unemployment benefits run out?
So you qualify for Social Security at age 62. The Elder Index starts at age 65. But that does raise the issue of people who are laid off at age 55 and cannot find a job. And like I said, the evidence is really clear that after age 55, your opportunities for reemployment drop dramatically. That would be an area for extended unemployment insurance. So right now you can run out of unemployment insurance. I don't know if anybody from the audience has other ideas. That's a challenging group because they are young enough to be working, but have trouble finding employment. You still need to pay the rent. There is some suggestion in the academic literature that some low-income people end up going on Social Security disability. So if they lose a job and they have a bad back, they end up going out on disability because there's no other options for them.
Thanks. For the poor and the hidden poor slides, any investigation of the homelessness rates across that continuum? Is it possible that the high rate of homelessness among Blacks and Native Americans may be tied to higher hidden poor homeless?
Feel free to chime in, Imelda, whenever you want.
So go ahead.
No.
Oh, well, I was just going to say the data we use is the American Community Survey, which is a household survey. So I would venture to say that our data, what we're showing here for older adults, for Latinos and Blacks, is underestimated for sure. And as we know, the homeless population is also aging. And so I think there's definitely a need to study that area and figure that out, because those, that population is a very vulnerable population, and we are definitely underestimating the economic insecurity for those folks.
Is there anything you want?
It's probably safe to say that if you're homeless, you're economically insecure.
Definitely. Could you discuss whether it's possible to urge the government to use the Elder Index when calculating cost of living adjustment for older adults?
So California does have state legislation that requires area agencies on aging to include the Elder Index as part of their annual planning process. It has not been adopted as an index for any particular policies or programs. I know when we've talked with legislators in past years, there's been a concern because when you say there's twice as many economically insecure people as there are eligible for this program, they go to their calculators and look at what it would cost and get cold feet. So I know a number of agencies, including I'm sure a number of people on this call, use the Elder Index as part of their planning process and as part of their rationale for soliciting funds from various sources to show the need that they're meeting, which may or may not be captured appropriately by the Federal Poverty Index, and or to show the need in their area. But it has not been proposed to my knowledge as a way of indexing any benefits. In fact, in the last recession, the state legislature, to save money, actually ended indexing of SSI. So, you know, it wasn't even a matter of using a better versus a worse index. They just stopped increasing the state contribution to SSI altogether. So that's a whole nother set of political issues. But a great idea. We'd love to see it used as an index.
So this person says there are many Central American non-citizens becoming older without the prospect of Social Security and access to Medicare. Is there data that show that number of people in this situation and the counties where they live? And can you just in general speak a little bit more about those who are undocumented as well as far as the rates for the hidden poor?
So with the welfare reform, with amnesty, they actually called it amnesty in 1986. Ronald Reagan signed the amnesty law that brought a lot of undocumented residents into a path to citizenship. And so if you look at the number of the estimated, nobody knows for sure, but if you use the best data available for the number of estimated undocumented older adults, the number right now is relatively low. The group that is coming up behind older adults is the post-amnesty group. And so the number of older adults who do not have authorization will be climbing rapidly in the next 10 to 20 years. And that is a worrisome population because they're not eligible for Medicare, they're not eligible for Social Security. The proposal to make them eligible for Medi-Cal was withdrawn when COVID-19, so there's another COVID-19 impact, right? So that was withdrawn when the state hit financial problems with COVID-19. So that was on the agenda to add. And that's a group that's gonna face unsubsidized healthcare costs and will have very low incomes because of their status in the labor force currently. So definitely a group to be concerned with. And a group who's generally spent 30, 40 years working in the California economy and contributing and raising their families, and you know, we'll hand them a lump of coal when they retire and that's it.
So we have some questions about how this information is being used. Can you speak a little bit about, you know, whether it's been shared with the governor's work on the 2020 to 21 master plan on aging, and to make recommendations to them, and just in general, who's using the Elder Index?
So the short answer is yes. The information has been fed into the master plan process. Everybody involved, all of the stakeholders involved in that are very aware of the Elder Index and what's involved. We've done briefings for California legislators, a number of different types of hearings where advocates have come together. So I don't know about people on this call, but I would say generally there's a broad awareness and understanding of California Elder Index, and that's keeps us going. You know, one of the challenges for people in academic settings is you often spend a lot of time on doing work and then it sits on a shelf and has very little impact in the real world. And the Elder Index has had a significant impact over the last 15 years in a number of venues. We'd like it to have more, but the fact that it is being used in counties, in the state legislature, in nonprofits, in foundations, and other sources really animates us to keep going on this work.
Thank
So
you.
I want to thank all of you, and also want to call out the United Way, who is using the Elder Index as part of their real cost index. So we only look at the 65 and over group, and so they've taken the Elder Index to sit on top of their index that they've developed, which uses a complementary methodology. So it's being used in a number of avenues.
Thank you. In regards to the hidden poor, there are older people living in very remote areas in California that may, among other things, suffer from food insecurity. Where are they counted if they are?
Melda, you want me to keep going?
You're on a roll, Steve.
So the economically insecure are those, generally those with incomes below 200% of poverty, and then they ask if people have enough money to buy healthy food through the end of the month. So what's interesting is most questions about food insecurity ask about, do you have enough money? And I would say, in general, if people are below the elder index, they're struggling to make ends meet. And so if they have enough money to pay for food, then they're probably scrimping on rent, or they're scrimping on healthcare. So they may answer, yes, they have enough money to buy food through the end of the month, but something else is suffering as a result. So if you want, you could, I don't think it would be an overstatement to say everybody who is below the elder index is at some level food insecure. Even if they're marshaling their resources to pay for food, that means they're not paying for something else generally. There's also the question then of, there's a different way of asking food insecurity, which is, did you have enough food through the end of the month? So it's not a matter of, did you have enough money, but were you actually able to marshal food through the end of the month? And once again, I would suspect that that's a big part of being economically insecure, is having trouble just keeping healthy food on the table.
Mm-hmm. So
it's not a specific question in the Elder Index, but if you think about holistically what being economically insecure means, that has important implications for food insecurity.
Thanks. Were taxes that homeowners have to pay included in the findings?
Yes. That was a simple one.
I love
it includes, like, if you're in a condo and there's condo fees, it includes the condo fees. If you're a homeowner, so that's why homeowners with a mortgage paid off don't show zero expenses, because they've got taxes and other expenses that they have to pay, even though they're not paying a mortgage. But those are substantially less than people who are paying a mortgage. So yes, it does include all the property taxes.
Do you have a side-by-side of the federal poverty level versus the Elder Index methodology?
Actually, we do. It's been a while since I put it out, but yes, we do. And we also compared it to the supplemental security. No, not the supplemental security, sorry. The, what is it? The supplemental poverty measure. I think that's what it's called. So we do actually have a comparison. If you want to email me, I can send that to you.
Thank you. Have you looked at the impacts of universal basic income for improving health equity?
We haven't modeled it out, but once again, so I talked about ways of increasing economic security. One was increasing income, and the other was decreasing expenses. Well, pretty straightforward. And so if you do a universal basic income, that would provide a floor. So that would, for a lot of these older adults, increase their income. Now, the devil's always in the details. So does that knock people out of SSI? So if you do a $1,000 universal income and people are getting $800 in SSI, that'll increase their income by $200, but not the $1,000 that you would expect. So implementation is an important piece to think through here as well.
Mm-hmm. do you have any information on how the expansion, excuse me, of CalFresh to SSI beneficiaries impacted food insecurity among older adults?
That'd be a great research question. And we were talking before this about a lot of the questions that come up are actually excellent research questions. And if somebody knows an entity that would like to fund that research, we would love to do it. But it should help, right? It should help because for people who don't know, it used to be that older adults who were on SSI could not get CalFresh because in 1974, they cashed it out. They gave them the dollar value of CalFresh benefits in 1974, which at the time was $10. But in 2015, they were still getting that same $10 and nothing more. So the ability to get CalFresh should have helped the food security for a number of these older adults. And I believe California Health Interview Survey would be able to look at that.
Thanks. We have time for just a couple more questions. Could you explain how you arrived at the 20% for miscellaneous expenses? And is there any analog to how the FPL or SPM measures poverty?
So the 20%, way back when, back in the old days before Melda, we sat down with an advisory committee. And so the Elder Index is based on a national effort for the Elder Economic Security Index, which is out of National Council on Aging these days. And they had a methodology, and we took that methodology and we worked through an advisory committee. And my memory is that they use a 20% miscellaneous cost as well. We did look at the consumer expenditure survey across different incomes and parceled out housing and healthcare and other elder expenses. And the 20% for non-indexed expenses looked to be roughly accurate given national patterns of spending. Now this was 10, 15 years ago, but my guess would be is it's been pretty stable. So that's how we came up with the 20%. And so that's carried forward. Federal poverty line doesn't, well, we don't have time. Another lecture how that was designed, but basically it looked at total expenditures and looked at how much people spent on food. They spent 1/3 of their family income on food, so they tripled it. That was simple. So that covers everything. The only thing they had to measure for was food costs. So they just tripled food costs, and that would cover everything, including miscellaneous expenses. The supplemental poverty measure is more sophisticated than that. And they use a consumer expenditure survey as a driver for their other expenditures as well.
Thank you, Dr. Wallace. Unfortunately, those are all the questions we have time for this afternoon. I know that there were a lot of questions, so if we did not get to your question, please email us at healthpolicy@ucla.edu and we will get back to you. I just wanted to thank you all for attending this month's webinar and release of the 2019 California Elder Index, and thank you to the presenters for these timely findings. We will be posting the recording of this webinar online with closed captions within the next 2 weeks. So please visit healthpolicy.ucla.edu. As a reminder, if you'd like a copy of today's presentation, please email us at healthpolicy@ucla.edu. And as Ninez mentioned earlier, if you haven't already, we invite you to register for our E.R. Brown Symposium happening on October 14th. Thank you very much and have a wonderful rest of the day.